Hello everyone, my name is Liliana Macias. I'm a registered nurse. I will be going over central line dressing changes for new graduate nurses in the ICU. My intended learner today is one new graduate nurse in the ICU. I will be using a cognitive domain, and I will focus on the objective of identify the policy and procedure of a central line dressing change for the critical care unit. In order to facilitate active learning when identifying the policy and procedure of central line dressing changes, I will be using an active reading conference. When using this strategy, I believe that these nurses will think before doing. They become more knowledgeable about the policy before they apply their skills into actual clinical practice. Okay, so I have my new graduate here. This is Miguel. He's going to be starting off in the ICU, and we're going to go over central line dressing changes. However, before going on to the skill set of this, we're going to be starting off with reading the policy together. So our active learning strategy for this activity is a reading conference. So we're going to read together the policy. I will read the first half, and Miguel, you would read the second half. So we're going to talk about the maintenance bundle components. So daily review of line necessity with prompt removal of unnecessary central lines and documentation. That includes daily review of a continued need of central lines that can be done in the following ways. During multidisciplinary patient care rounds, by using reminders such as stickers on patient records, via automated computer alerts, details of removal documented in records such as the date, location, signature, name, and operator. Hand hygiene before the manipulation of the IV system. Catheter injection ports, so open lumens such as catheter hubs or stopcocks are covered by injection ports, sterile end caps, or needleless connectors. Access ports are sanitized with alcohol, chlorhexidine, iodine, iodophors before and after each use, a method known as the scrub the hub protocol. Caps are changed no more often than 72 hours. Proper procedures for Thank you. Proper procedures for catheter site dressing monitoring changes. Change gauze dressings every 2 days, clear dressings every 7 days, and more frequently if soiled, damp, or loose. Okay, does that make sense, Miguel, what I just read?
Yes.
Okay, so it's really important to understand this part of the policy because we want to know when to remove a central line, why does a patient need a central line, how to keep it clean, like scrubbing the hub, make sure that port is clean every time you use it. Okay, Miguel, so now I'm going to have you read the other half.
Okay. Catheter access and manipulation. Aseptic techniques are used for all access to the line. Catheter site care is performed with chlorhexidine at dressing changes. In the absence of chlorhexidine, use iodine. Ports or hubs are cleaned using scrub the hub protocol prior to catheter access. Administration set. Primary and secondary replacement. Set is replaced no more frequently than every 96 hours and at least every 7 days after initiation of use unless contamination occurs. This replacement interval is safe and permits considerable cost savings to healthcare organizations with the following exceptions. Set is replaced immediately after administration of blood and blood products. Set is replaced after 24 hours following administration of infusates that enhance microbial growth. For example, fat emulsions combined with amino acids and glucose in 3-in-1 admixtures are infused separately. Needless components should be changed at least as often as administration set and no more often than every 72 hours. The evidence is less clear for intravenous sets that are used intermittently due to a lack of published research in this area. Infusate preparation using aseptic techniques. Healthcare personnel training. All staff members manipulating CVCs should be required to attend a hands-on training class in the proper techniques for caring for and accessing catheters, followed by a competency evaluation of CVC insertion, site, and hub care.
Awesome. Okay. So what you just read, does that make sense to you?
Yes.
So it talks about, again, the importance of aseptic techniques when manipulating a central line. Okay. Do you have any questions so far?
No.
Okay. Thank you.